The more intense and severe the swelling, and especially the bruising, the better the healing. The stronger the body reacts to the intervention, the better. The body directs not only its reserve capabilities, but all its protective resources right to the affected area.
Interesting take. I don't know that I've necessarily seen that in my experience, but I'm Dr. Anoni, restorative dentist at Nuvia's Tampa location. And today we are going to check out Dr. Izmagilov's video on dental implants.
Today, in Russia, hundreds of people get implants. Some lose a single tooth, others lose an entire row of teeth. People save up money, go through surgery, endure pain, wait 2 or 3 months for everything to heal, and are confident that their problem is solved for a long time. But after a year or two, complications begin, and sometimes even a second surgery is needed. And all this happens because they weren't told the most important thing, that implants are not suitable for everyone. Let's figure out what an implant is and what it consists of. It's what's called an artificial root, which will support our future structure or our future tooth. It is placed directly into the bone. If I turn it like this for you now, so for example, our patient is missing a tooth, we can easily place an implant.
So right now he's showing a very standard implant placed in the lower arch as a single implant. When it comes to having a full arch or a full mouth worth of implants, there are different kinds of implants also that are used, whether it be the maxilla or the mandible. But in the case of the maxilla, we can use longer implants that are up to probably 4 times longer than that and might anchor even in your cheekbone. So while he's showing one that replaces a single tooth, when we use implants to anchor a whole arch worth of teeth, they might look quite different. We just need to find proper points of stability in the arch to support the prosthetic teeth.
No one except our patient will see or notice it. After 2 or 3 months, or in rare cases after 6 months, we place a special connector on it called an abutment, which is screwed directly into the implant we've installed. The future crown.
That abutment looks a little bit different for a single implant versus one that we'll use for a full mouth worth of implants. An abutment that is going to connect a single crown is going to look exactly, like what Dr. Izmagilov is showing there. But typically the connectors that we use for the whole mouth look a little bit different than that and have different angulation, but make it so that we can actually screw our prosthetic directly into the connectors, and that can help support the teeth themselves.
Crown is placed directly onto the abutment. This is what implantation is. What do you absolutely need to know before getting dental implants? The first thing is, of course, the healing period. After the implant is placed, we need to wait before making the tooth is 2 to 3 months, or in rare cases, up to 6 months.
So in the traditional method of full arch dental implants, typically before you get your permanent teeth, they'll put you in some temporary or, plastic prosthetics or teeth to take you through that healing period. And then after the 6 months begins the process of finalizing it. Whereas here at Nuvia, yes, you are going through a healing process after you have your implants placed, but the beauty of our process is that you get your permanent teeth the next day after surgery, and those permanent teeth are virtually indestructible. They are incredibly reinforced, and so they form a really solid splint to actually help aid in this healing process. Based off of personal experience, I've seen that really rigid structure actually makes the healing go by more successfully than what I had experienced with the traditional method.
You mentioned on average implant healing takes 3 to 6 months. What determines this time frame?
For the implant to take hold well, in everyday language we say take hold, but in medicine it's called integration. This means that osteocytes, which are small bone cells, begin to grow into the threads of the implant. They actually grow right into the threads. And it's thanks to this process that we achieve fixation. So initially,
just a little bit of an aside about this osseointegration process he's describing. I wanted to give a little bit of insight on one of the factors that might make it difficult for you to get implants, and that would be if you've been on or have a history of IV bisphosphonate use. In cases where a patient might have osteoporosis, the balance of the bone buildup cells and bone breakdown cells, which normally are, working in a really nice state of balance. You're always remodeling bone. In patients with osteoporosis, the bone breakdown cells are actually in higher concentration, and that's what's leading to bone breakdown, right? So those bisphosphonate medications will stop the process of remodeling. So you're not having any more breakdown cells, but you're also not having any more buildup bone cells. And so that's why when we have an implant placed in a patient that has a long history of receiving these bisphosphonates via IV, it can compromise the integration of the implant because your body is not going through that bone remodeling process and doesn't have those bone buildup cells actually growing into the implants to lock them in. So that's why that's a point of caution.
Initially, when we screw in the implant, there is no such connection, yet the implant is held in place only by the threads. Then, gradually, these osteocytes, the bone cells, start to grow into the threaded connections. Another important thing to know before implantation is that, of course, you will have to go without a tooth for some time. So after the implant is placed, you will have to go without a tooth until it integrates.
So yes, it's true that for a single implant, it's likely that you'll be without a tooth for several months. But again, with the Nuvia protocol for our full arch, we can get you teeth, the next day. Obviously, there's always a small risk of, he was describing that stability of the implant on day 1, which is the threads against the bone. There's about a less than 1% chance that on day 1, those threads will not be stable enough against the bone. These are in cases where the bone is really, really soft, or the patient has a lot of really aggressive infection that's really affected the bone, and we can't find any stable bone. In those cases, we may have to wait a little bit before we place those final teeth, but in over 99% of cases, the whole arch can be delivered the next day.
The one in the middle, does that mean I'll have to go 2 or 3 months without a tooth?
There are different situations. Sometimes we place the implant and immediately put on the abutment, or let's say the healing cap, and we can make you a temporary plastic tooth to cover the gap. That is possible. But sometimes
And that exactly is, on a larger scale, what the traditional method is, right? A temporary kind of placeholder arch or tooth to get you through the healing period.
sometimes we can't immediately make a restoration on it. In that case, we also have several options. Option number 1, you will go without a tooth. Option number 2, the doctor tries to come up with something like an adhesive bridge where we attach a kind of bar to the neighboring teeth, and the doctor creates an artificial tooth right on that bar. You should be prepared for the fact that you really might have to go without a tooth for some time.
Another option that he doesn't mention, this is more for an individual tooth, is something that's removable, right? So whether that looks like a partial denture, or if you've ever seen, like Invisalign retainers, those clear kind of shell retainers, sometimes we can put a fake tooth in there, that is removable, but we'll get a patient with an individual implant through the healing period.
Prepare if you decide to get an implant for significant swelling of the mucous membrane and visible tissue swelling. Of course, the intensity and severity of the swelling depend on various factors, both on the individual's body and on the specific nature of the procedure performed on the patient. The swelling reaches its peak on the 3rd day. So after we've placed the implant, the swelling is at its maximum on the 3rd day.
This is all very true, and in particular with our procedure where it's the full mouth, there is a really broad range of what normal looks like. So some patients will have this procedure done and, come in for their teeth the next day looking like literally nothing happened, and others will come in with much more significant swelling or bruising. It is very patient dependent, but typically, although the swelling will peak around day 3, each day we're looking for incremental improvement, and by the time that the patient comes in for their 2-week follow-up, I would say like 99% of the time patients are pretty much back to normal.
But after that, it gradually subsides. In fact, in my experience, there's a clear trend. The more intense and severe the swelling, and especially the bruising, the better the healing. The stronger the body reacts to the intervention, the better. Because during any surgery or trauma, the body directs not only its reserve capabilities, but all its protective resources right to the affected area.
Interesting take. I don't know that I've necessarily seen that in my experience, but again, it's very, very patient dependent. We've seen excellent healing out of patients who have no bruising and no swelling, as well as excellent healing from patients who have really aggressive bruising or swelling. It depends on the patient and also their habits, smoking, grinding teeth together, and adhering to the soft diet. Like all these things play into it. But also, systemic conditions, right? Which I'm sure Dr. Ismagulov will go over, and we'll check back in at that point.
The healing is really good. A strong bone callus forms, especially after bone grafting. We take an X-ray, and after just 6 months, there's already a huge amount of new bone growth. You also need to be prepared before the implantation procedure and before deciding on implantation for the possibility that the implant might not take. Why might an implant be rejected? Well, actually, there are quite a few reasons for that. The first reason is the individual characteristics of the body. When it does not accept or does not tolerate the alloy titanium itself or the small impurities that remain in the titanium. Even though modern titanium is now purified from additional metal impurities, which, by the way, used to be a factor in rejection. The second reason is...
That is a good point. The way that titanium has been modernized, we see this less and less. I mean, personally, I've seen placement of over, I guess we're approaching about 10,000 individual implants that I've kind of seen over, and a titanium allergy hasn't been present in any of the patients that I have seen for that. So it is incredibly, incredibly rare, and in particular with the quality of titanium that's being used today. Another good point there is you should make sure that the provider that you're seeing is using reputable implants, right? You want to make sure that you're getting high quality titanium placed from a reputable implant company as well, not just a great dentist. And so that's a very prudent question to ask your provider, what kind of implants are being used, because the branding and manufacturing can play into the kind of titanium.
Of course, any additional already existing comorbidities. At the end of this video, I'll tell you exactly which diseases make dental implantation impossible. If the implant is still rejected or fails to integrate, or in simple terms falls out, in this case, of course, there's a specific protocol that must be followed.
So the systemic diseases that he did mention, I know he'll probably circle back and mention them, but diabetes is one that we like to keep a close eye on. We want to make sure that our diabetic patients who receive dental implant treatment are controlled diabetics. A1C, let's say 8 or below, is going to be a green light for us. But the very few failures that I myself have seen, again, about less than 1% or about 1% of cases. A couple of those have been because a patient's A1C may have been fine at time of surgery, but then got out of control over the 4-month healing period, and it really compromised the body's ability to heal. I did have one patient who had surgery at an A1C of 8, came back, had 2 implants fail, and when we checked her A1C, it was at a 12. She just stopped taking her metformin. So yeah, that's definitely something that you want to keep an eye on if you are a diabetic and also considering implant treatment.
We contact the manufacturer and order additional tests. As soon as we understand the cause, we calmly reinstall the implant. We simply take it out and put in a new one. We observe again to see what happens. You can reinstall the implant or place a new one on the very same day. Most often, of course, an implant will never just fall out of your mouth like that. But we can see it on the X-ray. You come in, we see this problem on the X-ray, and basically we unscrew it ourselves, clean the area, and place a new one if possible.
Most of the time, if an implant fails, it will be visible on an X-ray, but sometimes it's not. And in these cases where it may not be visible in the X-ray, we would confirm this physically. So at the 4-month mark, 4 months after surgery, a patient will come in, have the prosthetics removed, and then the doctor will individually check and test each implant to make sure that that integration process has happened successfully everywhere. So there's different ways that we can tell if there happens to be an issue with the implant, but the only way to know for sure is to go back into surgery and have the surgeon remove the connector and actually test the implant. We have good protocols in place to make sure that we can identify if an implant has failed.
Sometimes, on the contrary, we unscrew it, clean it, and then let the patient go for 3 to 6 months so everything can heal and form properly. And then after 3 to 6 months, we place a new one. I would like to emphasize, very often, even when coming to our clinic, the patient has already been to more than one clinic or seen more than one doctor, but there is still no full understanding, not just of the price itself, but it seems to them that they need to pay everything here and now. And then indeed, the total amount seems quite overwhelming and intimidating. When we explain that you don't have to pay the entire amount at once, first the patient pays for the implant placement, and then we let the patient go for 2 or 3 months without any worries. Then they come back, pay for the placement of the healing abutment, and only after that, in about 2 to 4 weeks, they will have the crown placed and pay for it.
So that's a great point. Dental implant treatment, whether it's a single implant, one arch of implants, or a full mouth of implants, can come at, a fairly high cost. But a lot of times there's a lot of confounding factors and you're not sure which options to go with or even what kind of financing options might be available. If you want more information on that, you can go ahead and download our free cost guide that you can find in the description below the video. And if any of you have any questions on how these implant concepts might apply to a full arch worth of implants, please do comment below because we are happy to answer any questions, and I might even have a follow-up video to answer any further questions you might have.
I've told you what to prepare for before the implantation procedure and what to expect. And now I'll tell you about the less obvious advantages of implantation. For me, the main advantage of implantation is, of course, the so-called preservation of the neighboring teeth. So if we are talking about this kind of structure, or rather this kind of clinical case where one tooth is missing, in the past we would have had to place a bridge and grind down the 2 neighboring teeth to replace this defect. But now, thanks to implantation, we can simply place an implant, put on a crown, and our 2 neighboring teeth remain completely untouched, healthy, and will last for a very, very long time.
This is a great point when considering the difference between a bridge or an individual implant. If you want a deeper dive into the differences, advantages, and disadvantages between the 2 procedures, click on this video here. I go into detail about it and can answer any questions you have.
That's why, for me, this is one of the main advantages. The second advantage is the high and predictable success rate, which is very high in percentage terms. In fact, it's really between 98 and 99.8%.
This is true for individual implants. For a full arch worth of implants, the national average is somewhere between 94 to 96% success rate, which is really high. Here at Nuvia, we are pleased to report that we are over a 98% success rate. Pretty impressive for a full mouth of permanent teeth given to you the day after surgery.
The advantage, of course, is comfort. If we compare removable dentures that a patient wears with implants, the difference is enormous. With implants, we can make a fixed, non-removable structure. This means the patient will be as comfortable as possible and won't have to worry about anything falling out.
Not only that, but also when you're wearing a full denture on the upper, it completely covers your palate. That means it changes the way that things taste. Really aggressively can affect how you speak, and also may shift and move while you're speaking or eating. On the lower, you don't even have suction on that arch in order to keep things in place. So that means lots and lots of pace to keep the dentures in place. Obviously, a fixed option makes a huge difference when it comes to quality of life, speaking, eating, chewing, all these things. So that's definitely an advantage that implants have over something removable.
Thanks to implantation, we can stop the process of bone atrophy or bone loss. When there is no load on this area, the bone can become softer and indeed it starts to recede. That's why when we place an implant, our bone starts to function.
That's also a really great point. Implants help to preserve the bone level. So I have many patients who end up needing implants because they have periodontal disease or because their bone is kind of shrinking away from their teeth over the years. That kind of pathology or disease doesn't carry over into implants. Teeth have a much different relationship with bone than implants do. Around teeth, there's a whole ligament space and what we call the periodontal complex, right? With implants, your bone grows directly into them. And so that implant and the function that is occurring with that implant helps to hold that bone level. So you won't be experiencing the same kind of atrophy and loss if you didn't have it.
In other words, it recognizes that there is a load on it and bone loss does not occur. The next point is the guarantee. What does that mean? For each implant, you are given a special certificate with an individual identification number. There is extensive coverage worldwide, and you can always take this certificate with you and show it at any clinic in the world. Here, I have this implant. Here is its number, and you will be assisted in any country.
A point about that, knowing the kind of implant that's in your mouth, we kind of already talked about assuring that it's a reputable implant company, right? But knowing the kind of implant system that's used is really important, in particular if you travel a lot, right? Here within the country, there's over 50 Nuvias that you could go visit if you ever have any kind of issue and need it evaluated. But if you are overseas, let's say, or somewhere inaccessible to a clinic and you need to see a dentist for any reason, every implant system has a different connection or like head of a screw. So if you think about using a Phillips head versus like a Torx or a flat, like the actual head of the screw needs a particular driver in order to be able to manipulate it and move it. And if you use the wrong driver, even if it's the wrong diameter by 1/10 of a millimeter, that can completely strip the screw and bring serious problems. Knowing the kind of implant, in particular if you're traveling abroad, is going to be important for you once you have implant treatment.
Another advantage to add to the list is speed and durability. The procedure of installing even a single implant like this takes at most 20 minutes. And as for durability, of course, with proper care and regular checkups, at least once a year, ideally every 6 months, this implant will last you a lifetime.
Speed is another wonderful thing to note here at Nuvia, and I would say at least in our office here in Tampa, when a patient is undergoing this full mouth surgery, they can expect to be in actual surgery for between 1 to 2 hours. And that also includes, having a CRNA there for sedation purposes. After that, the restorative portion of the day starts. But the actual surgical procedure, our surgeons are so well versed, do this day in and day out. Many of our surgeons have completed over 500 arches. Here at Tampa, each one has completed over 1,000 arches. That has a real impact in the surgery time, the efficiency and the efficacy, right? So not only considering surgery time, but the speed with which you will get your permanent teeth next day. Can't beat it.
Who is definitely not a candidate for implantation or getting implants? First and foremost is diabetes, specifically its decompensated form, when medications are no longer effective in controlling your blood sugar. If you have such uncontrolled diabetes, implantation is not suitable for you.
Agreed. We went over that earlier. So if you are a diabetic patient and you would like to get implants, making sure that your A1C is under control, manageable, and consistent is going to be your top priority. Just this past week, saw a patient, he got his A1C down to 8 from 16 only a few months ago. So it can be done, and we want to be here to help you to get your final teeth, but we want to make sure we're doing it with a healthy foundation as well to give you the best long-term success.
The next contraindication is cancer. That is, if a patient is under the care of an oncologist, implantation is contraindicated.
There's different kinds of cancer, obviously, that can affect the ability to get implants. For us, if a patient has received radiation to the head or neck, let's say with cancer in the tongue or the throat or the jaws, that would likely be a contraindication because the bone cells themselves are not functioning as they would in a normal circumstance, and so those build-up cells may not be performing. Other kinds of active cancer, especially in other organs within the body, can impact whether or not the procedure can be done. Usually we like to wait until a patient is in remission in order to perform the procedure itself.
Next contraindication for implantation is patients who are taking so-called bisphosphonate medications. These medications are taken by patients during the treatment of osteoporosis, and also in the treatment of cancer. Another
So the IV bisphosphonates, that is something we touched upon. It's not to say if you've ever taken any kind of bisphosphonate, you can't have this procedure done. We do evaluate everything on a case-by-case basis, and sometimes there's an opportunity to take a drug holiday, in particular if it's an oral bisphosphonate, but it is something to consider if there's a long history of it and it is administered via IV.
And the final contraindication is age under 18 years. It may seem completely unexpected, but for patients who are under 18 years old, and in exceptional cases even up to 21, implants are contraindicated. This is because the formation or final development of the dental and jaw system is still ongoing at that age.
And in males, actually, that process goes on a little bit longer than females. So age definitely is something to consider, but hopefully, you know, except for some very extreme cases, we won't need to be doing a full arch of implants for someone under 18.
Be sure to tell your family and loved ones about these contraindications. Or better yet, share this video so that as few people as possible make mistakes when getting implants.
Another very important contraindication that I touched upon lightly at the beginning of this video when I mentioned habits, smoking is one where it is very much contraindicated, in particular during the healing period. Not just the negative pressure of like the physical act of smoking, but also, you know, the smoke itself. All of this can impede the healing process. And again, out of the very few failures that we have seen, smoking has been a culprit at times. One more consideration, in particular when looking at a full mouth of dental implants, is if you are a very heavy bruxer or grinder. So if your teeth are completely worn down because you've been grinding for years and years, a different kind of commitment may be needed from you as a patient than someone who doesn't, right? Like addressing the grinding, whether it might be, you know, through acupuncture, massage, Botox of the jaw muscles, full-blown commitment to wearing a night guard every single night, which we ask for all of our patients, but in particular for our grinding patients, that might be necessary. So again, not to say you can't get implants if you grind your teeth, but it is certainly something to mention to your provider when considering a full mouth of dental implants. All right, guys, saw a couple of comments that I might actually be able to help with. So if this was a question in your mind, hopefully these answers give you a little bit more clarity. Seven Ravens writes, what wasn't mentioned is a requirement for a bone graft if the tooth has been missing for a while. Holy 2 weeks of constant pain. So in some cases, in particular for an individual implant, you may need a bone graft. That is when a provider may use some bone chips, sometimes human, sometimes bovine, and put it into a site so that it creates a scaffolding so your body can create new bone that grows into that scaffolding and creates a better base for the implant. Now, when we are doing a full mouth worth of implants, sometimes, actually most often, a bone graft is not necessary. It may still be used in rare cases where a patient might have a really large infection or a large cyst that needed to be removed, but for the most part, the leveling portion of the surgery would take care of any need for a bone graft. Another person says, the first thing you need to know is the company of the implant. This is mandatory because some companies are less popular and you can end up stuck with implants that no one can handle. I noticed that your video doesn't mention about the actual company, you just present a card. A lot of other things must be revealed before proceeding. People have unrealistic expectations from unknown implants. This is very true. We talked about this, knowing the company of your implant. For example, here at Nuvia, we use Neodent implants. You can't go wrong with Neodent, Straumann. There's several very reputable companies that providers can go with. And knowing that is going to help you in the future if you can't get back to your original provider, finding a provider that has the equipment necessary to deal with complications or problems with a particular implant company. If you liked this video and found it helpful, please give us a thumbs up. And again, don't hesitate to leave any questions or comments you have underneath the video, and we will get to them as soon as we can.